Welcome to Balanced Body Podcast. I'm Dr. Brent Anderson with Polestar Pilates and Physical Therapy here in sunny Miami. And today I wanted to talk to you a little bit about working with clients who actually have very special needs. And this is regressing back to what we might call pre-Pilates. And we create an exercise we call 90-90 with the idea that we can completely suspend the body or the body part in the air that gives us ability to move them. So let's think of patients maybe that have suffered a spinal cord injury that might be paralyzed from waist down, or patients that have acute flare-up of rheumatoid arthritis in their knee, or a recent knee or hip surgery, or even acute low back pain where they just can't even move, they barely come in. So this is working with people in a very acute state or people who do not have control over their own body function in these particular limbs. So what I'm going to do is just hook up these straps. We have these Velcro straps that are in place, made by Balanced Body. And the springs, both from above and from below, basically make it so the leg is suspended at a 90-90 position, hence the name 90-90. And we get both of these legs connected up in the air. And so from here now, we have a variety of things we can do. We can provide just gentle passive range of motion into a joint just by doing circumduction or flexion extension. I can concentrate on the knee joints. I can concentrate on the hip joints. I can even concentrate on the ability for them to move together or to move separately. So we can do like a little alternating movement. Now, once they have a little bit of movement, they can take over and start doing little gentle exercises of moving back and forth, right and left leg, and creating a little bit of stability challenge to the pelvis. But again, this is a very, very basic exercise. Go ahead and relax. I'm going to take the right leg out of the strap so that I can demonstrate a couple techniques that I would do with the left leg. Just to repeat that, we're going to do a little bit of movement with the left leg now. One of the things I like to be able to do is what we call posterior glide of the hip. And it's often like the shoulder, we lose congruency and the anterior hip comes anteriorly in the socket. And what we want to do is reverse it back into the socket so we have maximal congruency. There's a great place, even when people have acute hip pain, you can just basically take hold of the femur and just gently drive the femur straight down. So I'm pushing straight down into the socket to be able to get that posterior glide of the hip. And again, a very gentle, very relaxed area. I think there's something magical about having the leg suspended also that makes it so that the patient can relax. They're not really worried about you dropping their leg or their knee, and it just provides a really nice environment to start restoring some movement without pain. And one of our sort of underlying foundational theories in Polestar is successful movement without pain, and that's exactly what we're looking at here. This is Brent Anderson bringing you a podcast for Balanced Body from Miami. Look forward to seeing you in the next one.